Following a near two-year conflict between the government and doctors over the medical school admissions expansion, the government has today announced a concrete plan. It says it will gradually raise the quota over 5 years, but the medical community says it's no different from previous proposals. Ahn Sung-jin has the details.
South Korea has finalized its medical school quota increase after a prolonged dispute since 2024. The government has put forth a 5-year plan to increase medical school admissions starting from the 2027 academic year to address regional and public healthcare shortages. Following a meeting by the Health and Medical Policy Deliberation Committee on Tuesday, the Health Ministry says that enrollment will, on average, increase by 668 students per year from 2027 to 2031, adding up to a total of 3,342 students over the next 5 years. The government is emphasizing that it's a gradual increase to avoid strain on medical education.
The committee has decided to implement the medical personnel expansion in stages, taking into account medical school education capacity, as well as the establishment of public and regional medical schools.
All additional places will be allocated to 32 medical schools outside the capital region and will supplement the regional doctor track, which requires graduates to work in their hometown for 10 years in an effort to strengthen local and essential healthcare services. The ministry said it will provide full support through residency and regional settlement. Compared to the previous administration's plan to add 2,000 students annually over 5 years starting in 2024, the scale of the current expansion has been reduced to roughly 1/3 of that. The Korean Medical Association criticized the plan immediately during an emergency press conference. It argued that the government's workforce projections lacked a basis.
The stated purpose of expanding medical school quotas was to address shortages in regional and essential healthcare, but the measures discussed so far fall short of providing a real solution. There seems to be no significant change from previous proposals.
The expansion of medical school quotas has been the source of intense conflict between the government and doctors since 2024. But with university-specific quotas to be finalized in April, following a review by the Education Ministry, all eyes are on how the medical community will resolve lingering issues. Ahn Sung-jin, 아리랑뉴스.